The pandemic's disruption of significant events and everyday life is undeniable, but its effect on certain populations can be more severe, depending on these groups' socioeconomic status or their access to essential services. We recently sat down with University of Arizona anthropologist Megan Carney to discuss how the community can come together to support one another.
We know we're social beings, and we know that our survival depends on the survival and thriving of others. So in that regard, we are only as safe and healthy as the most vulnerable in our society. And we, rather than thinking in terms of us versus them, where we're preoccupied with wondering who belongs and who does not belong, we have to remember that we are all human and we have human needs.
You mentioned the vulnerable population. Here in Arizona, we are a border community. What do we make of migrants who are also grappling with how to respond and whether or not they can or cannot seek resources and services?
That's a really good question. So prior to pandemic being declared, there was already significant fear and anxiety in many immigrant communities in the U.S., communities that I've worked with for the past decade, about seeking health care, about coming into contact with entities that they perceive somehow associated with state authorities or government authorities. And the primary reasons for that are that they fear deportation, the possibility of deportation if they or someone in their family lacks immigration status, if they are of undocumented status. So that's a legitimate fear that has existed before pandemic.
What makes us resilient as humans in processing this and in using the terrible things that have come from it for some good?
As an anthropologist, I do obviously draw comparisons across different social and cultural contexts. One area of my research in Italy has been looking at solidarity networks. And so solidarity, social solidarity, is actually a seasoned practice in Italy. And solidarity networks are more or less the antithesis of individualism. And there's three core principles of solidarity networks. One is material support, so food, shelter, clothing. Another is collective well-being, so thinking about the well-being of the collective. There's no disparities, right, in who has access to what material resources. You have this collective sharing, and you are constantly thinking of the well-being of the collective. And thirdly, an emphasis on strengthening social relations or social relationships, and less on things like the economic bottom line. And we're starting to see some expressions of mutual aid, solidarity popping up here. At the University of Arizona, where I work, there are also efforts to explore the possibility of facilitating mutual aid networks on our campus and among different constituencies within the campus community.
So some hope that we can come together despite all this. Okay, Dr. Carney, thank you.
Thank you so much.